This exercise that we're now going to demonstrate is a closed kinetic chain strengthening activity. That means the exercise is going to be performed in weight bearing. We're going to be using a step, and we're going to demonstrate this exercise at an increasing level of challenge from easiest to most difficult. We're going to demonstrate the basic level 1 isometric weight shift over a small step. The patient starts standing in front of the step with the device on the leg. The patient will place the leg up onto the step. When the device contraction is felt to come on, the patient will weight shift a comfortable amount of weight over the step and lean into somewhat of a track start position. When the contraction releases, the patient can shift their body weight to the back leg to rest. These weight shifts continue with the timing of the contraction on the device protocol, shifting forward when the contraction comes on, shifting back when the contraction releases. The patient shifts a comfortable amount of weight over the leg. The basic level 1 weight shift over the step can also be performed in the lateral position based on patient comfort. The patient again starts standing, this time next to a shallow step. They place the foot onto the step. When the contraction of the device is felt to come on, the patient shifts a comfortable amount of body weight over the limb that's on the step with the device. When the contraction releases, the patient shifts back onto the opposite limb to rest. These weight shifts are performed in sequence with the contractions of the device. The same alignment considerations should be followed when performing this exercise in order for it to stay safe and comfortable for the joint. There are several alignment considerations when doing the weight shift over the step. When the body weight is shifted forward, it's important to shift using motion both at the hip and the knee joint, getting an adequate amount of forward trunk lean. We do not want to see the knee pushing forward beyond the toes excessively with a more upright trunk position, but rather we want the patient to lean forward at the trunk with a slight angle of flexion at the hip to accompany the flexion at the knee. This will create a more balanced hip and knee moment. More alignment considerations should be made when looking at the patient from the front view. It's important that as the patient is weight shifting onto the step, that good alignment is preserved up the limb and at the trunk. The knee should stay aligned over the foot, the hip over the knee, and a balanced vertical trunk position. The patient wants to avoid excessive leaning to the side at the trunk, over the stance limb, and collapsing inward of the thigh underneath the knee. This inward collapse of the thigh would create abnormal forces at the patellofemoral joint, which would make the quadricep contraction with the device uncomfortable. Proper knee alignment allows the joint to stay in a healthy position as the quadricep muscle is being strengthened. For the level 2 step exercise, the patient again starts behind a step. The foot is placed up onto the step, and when the contraction from the device is felt to come on, again weight is shifted over the leg, but this time the patient presses up the step by straightening through the knee and hip to raise up the full step height. When the device contraction releases, the patient lowers back down and shifts the weight onto the back leg to rest. This is started at a shallow height of a step per the comfort of the patient, with the patient performing a step up with the contraction and stepping back down and resting when the contraction releases. The level 2 step up exercise can also be performed from a lateral approach off the side of the step based on what's comfortable for the patient. The patient starts standing off the side of a shallow step and places the foot up on that step. When the contraction from the device is felt to come on, the patient shifts the weight onto that limb and slowly presses up the step with the timing of the contraction. When the contraction releases, the patient lowers back down the step and shifts the weight to the opposite leg to rest. It is important to follow the same alignment considerations as laid out with the level 1 exercise. not allowing the thigh to collapse inward underneath the body with either the raising or lowering phase. It's also important that the patient does not excessively shift their trunk over to the side during any phase of the movement. For level 3 and level 4 with the stepping exercise, there are several different ways that you can increase the intensity with the exercise. This selection should be based on the patient's comfort at the knee and their competence with a given exercise. You can perform either the weight shift or the step up with a higher height step. You can also use a bathroom scale under the patient's foot that is on the step to monitor the amount of body weight that is being shifted, with the goal to be to gradually increase the amount of body weight shifted and maintain a consistent amount of weight being shifted with each repetition. You may also use weights or a resistance band to increase the demand as the patient weight shifts or steps up a given height step. If a patient does not tolerate stepping up and down a higher step, you may consider keeping the height of the step shallow, but employing some type of external resistance, such as hand weights or a resistance band.